The American Association for Critical Care Nurses, or the AACN, is dedicated to providing critical care nurses with the best evidence-based knowledge and skills through their various courses and certifications. The AACN is driven by the following mission statement. Patients and their families rely on nurses at the most vulnerable times of their lives. Acute and critical care nurses rely on AACN for expert knowledge and influence to fulfill their promise to patients and their families. AACN drives excellence because nothing less is acceptable. In 1969, the American Association of Cardiovascular Nurses founded to help educate nurses. The AACN had humble beginnings, with the association's first secretary keeping those first year's 140 membership cards in a shoebox. In 1971, the AACN changed its name to American Association of Critical Care Nurses, with focus on improving healthcare systems and delivering patient and family-centered care. Also in 1971, the AACN began publishing peer-reviewed scientific journals, and they currently publish the American Journal of Critical Care Nursing, Critical Care Nurses, and AACN Advanced Critical Nurse. In 1976, the first critical care specialty certifications was offered for care of adult, pediatric, and neonatal patients. Today, they offer 15 different specialty certifications in critical care. The organization has grown exponentially since those humble beginnings, and in 2019 they celebrated the 50th anniversary of the organization, with 120,000 members in 200 chapters in the United States. At the present day, they are the world's largest non-profit specialty nurse organization. The AACN emphasizes the values of accountability, leadership, innovation, and collaboration to achieve their vision of quality, patient, and family-centered care in the critical care setting. A recent extensive integrated review of various studies and articles was conducted by a group of university professors in the field of nursing. The studies looked at the development of critical care nursing competence by reviewing different criteria for acquiring competence in the critical care field. Their conclusion matches the same qualities that the AACN strives for, and found that practicing intensive care nurses who have developed professional competence embrace the technical aspects of care assessment and delivery while also creating an environment of caring for intensive care unit patients and their families.
The AACN does tons of advocacy work. Most recently, with COVID-19, they have been actively writing letters and urging U.S. Senate and House of Representatives and committees related to healthcare to address issues with PPE and ventilator supplies, as well as proper planning for the future so that shortages will not happen again. They have also been encouraging leaders to include nurses in the conversation and decisions about how to handle the pandemic. They also do advocacy work around equality, diversity, and inclusion by providing trainings for staff members of healthcare facilities. Their goal is to eliminate discrimination and inequalities in patient care from the healthcare system. This is an image of a breakdown of their advocacy work around healthy work environments. My favorite thing I learned when I was researching the AACN was their push for appropriate staffing by encouraging facilities to shift their perspective on staffing from an expense to an investment in patient safety. They also take on advocacy work with the government to participate in legislation that affects critical care nurses and the nursing practice. Finally, their clinical advocacy is where they develop, review, and endorse new research related to critical care nursing so that critical care nurses can practice with the most up-to-date information.
The cornerstone of the AACN is their multitude of certifications. Becoming certified as a critical care nurse, or CCRN, not only benefits you as the nurse, but it also benefits the patients, families, and your employer. Certification gives nurses the ability to validate their skills and knowledge, as well as providing better patient outcomes with more confidence. Certification not only gives the nurses increased job satisfaction and self-esteem, but it helps create a safer patient environment with higher quality care. Patients are more likely to choose hospitals that employ nurses with specialty certifications, and this allows employers to create an environment of professionalism. There is a wide variation among financial benefits of becoming a certified critical care nurse. Some are offered bonuses, and others are given salary differentials upon certification. Overall, certified nurses have higher job satisfaction, and hospitals who offer certification programs often have improved employee retention. The AACN offers several different options to become certified as a critical care nurse. Resources include an exam handbook, review course, and practice exams. Any nurse with a valid RN license and in good standing with their licensing agency is eligible for an AACN membership. Membership is offered to any RN students who are participating in an accredited nursing program. Benefits of membership include discounts on certification, online learning, and access to nursing journals. The AACN offers hundreds of continuing education courses and activities. Some topics include respiratory failure, ultrasound-guided IV insertion, assessment and management of delirium, and many, many more. Some continuing education activities are even offered free of charge. Nurses can earn credits towards their certification renewal.
The AACN is an organization whose vision is dedicated to creating a healthcare system driven by the needs of patients. Acute and critical care nurses rely on the organization of their expert knowledge and support in order to successfully fulfill those needs of the patients and their families. As mentioned earlier, during advocacy, the AACN's Healthy Work Environment model provides the pillars that nurses need in order to be able to provide the highest standards of care while also being fulfilled at work. The AACN has 6 standards of the healthy work environment. These standards are skilled communication, true collaboration, effective decision-making, appropriate staffing, meaningful recognition, and authentic leadership. The healthiest work environments will integrate all 6 standards to help produce effective and sustainable outcomes for both patients and nurses. When nurses are happy, patients receive optimal care. However, if nurses aren't set up for success and their needs aren't met first, the safety and success of patient outcome suffers. Through AACN certifications and continuing education, nurses can better advocate for themselves and for their patients. Ultimately, when nurses are supported and heard, they're likely to feel more confident and appreciated and valued. Adequate, appropriate staffing equals more quality time with patients, less rushing around and less errors made. An increase in nursing confidence equals an increase in patient advocacy, leading to better patient outcomes such as shorter hospital stays, more effective treatments, speedier recovery, less readmissions, less costs for patient and facility, higher patient satisfaction.
At the same time, the AACN is advocating for the health and efficacy of the individual registered nurse. A derivative of these actions would, of course, be felt in the public health. While the AACN does not marshal its own corps of registered nurses to directly perform nursing actions, collective actions of the group is felt in the broad public health, such as when the AACN appeals to regulatory bodies, whether institutional or federal, as well as the individual nurse, to enhance patient care through evidence-based practice. As registered nurses are at the forefront of managing the whole of a patient's care, adaptation to new requirements or reforms will also be felt in the interdisciplinary team. The measure being that the body of clients benefits the most when new requirements are reflected optimally in the acquisition of intended end goals and favorable outcomes. The order of magnitude of members within the AACN, the largest specialty nursing organization in the world, gives pertinence to its advisory and cautionary role. The AACN lends its voice and supports fellow nursing organizations in matters affecting the healthcare system. In doing so, it speaks on behalf of all nurses in order to best serve the ethical and moral interests of the patient's access to timely, efficient, curative, and palliative care within the health system. The American Association of Critical Care Nurses and organizations like it function collaboratively to advance these interests, cognizant of the relationship that politics and policy have to the holistic needs of a client and significant others. In the past year, the AACN has lobbied for federal action to protect society and members of healthcare's frontline, either through providing testimony in Congress, a commission of letters to Senate leaders and advisory committees, and discussions held at the White House. The legislation sought for in these trying times seeks to mitigate the rapid progression and harm of the current COVID-19 epidemic. Perennial requests for funding are also on the forefront and mainstay of AACN's agenda, especially in regards to Title VIII, which increases the numbers of professional nurses through supplemental funding of nursing schools, increases the access to higher levels of education for APRN students, as well as seeking out financial support for research through the National Institute of Nursing Research.